No. Ladies and gentlemen, dear colleagues, welcome to this afternoon session. The topic of today is the management of early laryngeal carcinoma, and we will focus on several presentations according open surgery, IMRT, transoral surgery, as well as photodynamic therapy. And I'd like to begin and start with the statement of the National Cancer Institute published in April this year. It says that small superficial carcinomas can be treated efficiently by radiation and organ preservation surgery. Both are achieving very good and excellent oncologic results. And the final statement is that radiation may be selected to preserve voice, and that surgery is for reserving in the salvage situation. So I think this is a very interesting discussion point, and I like to hear also the comments from the audience. With the goal of our treatment is, I think, to reserve a quality of voice which is excellent for our patients, and I think we have to guarantee that the patient has a safe and good swallowing function. So we are looking to all these treatment procedures. And looking into the literature, there might be differences between the several locations within the larynx, especially in these early situations of carcinoma. This is a recent publication coming from Buffalo in New York, including more than 2,600 patients with supraglottic carcinoma T1 and T2 without any lymph node involvement. This is a retrospective analysis. The majority of patients, 87%, received radiation only. Another 7% had oral organ preservation surgery, and another 6% had a combined surgical approach, organ preservation surgery plus a neck dissection. And you can see the Kaplan-Meier plots of this retrospective analysis, and I think we have to consider the majority was treated only with radiation. But you can see the best result and the best outcome was for those patients who had surgery, namely organ preservation surgery, including a neck dissection. And those who had radiation only had a worse outcome. So looking on some other open questions, I like to pay your attention to the different possibilities of the diagnostic procedures. As a radiation oncologist and radiologist, I think it's very interesting to discuss, do we need other imaging procedures besides the typical endoscopic examinations? So is there any benefit and additional information, including multi-slice CT procedures with the possibility of multiplanar reconstructions for the surgeon and the pre-assessment of operation and for the radiation oncologist? And I think in the situation of a recurrent disease, we should discuss, is there a role for functional imaging when looking to the PET CAT scans or PET MRI scanning? But now I think we should start, and I'd like to introduce the panelists. The first talk is given by Bartolomé Scola from Madrid. The theme is open surgery, followed by IMRT by Sean McBride from Memorial Sloan Kettering. The topic transoral surgery will be presented by Karsten Palmer from Sydney, and finally Meryl Beal from Minneapolis will talk about photodynamic therapy. All these talks can be discussed soon after, and then we like to continue in this session with case presentation, including the audience. Thank you.